Did you know that gas, diarrhea, and stomach pain is the most common side effect of metformin? It's the absolute most common reason that my patients end up dumping this medication in the garbage. But it doesn't have to be that way for most. Just by taking a few steps, like when you take it, what you take it with, and even what kind of metformin you have, can make a big difference in being able to take this important medication. Hi, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. In today's video, we're going to be going over 4 simple steps that can help you tolerate taking this important medication. Now, if you're looking for more in-depth discussion on metformin, you can check out my other video on metformin right here. Abdominal pain, gas, diarrhea, and bloating are still the most common effects that we see with this medication, but there are 4 things that you can do to decrease this chance. The first one is take it with food. Metformin can have a possibility of affecting the stomach and gut lining, and taking it on an empty stomach can increase that risk. It's a medication that is usually given once or twice a day, so taking it with meals has been shown to improve your chances of avoiding some of those side effects. This is especially true while just starting on it. As your body gets used to it, it doesn't seem to be as important, but if you at least start out taking it with food, you'll likely do better. Now the second is ask your doctor if the extended release tablets would be appropriate for you. It comes in both an immediate release and an extended release version. The good news is the 500 mg tablets are generic and cheap, so it can be a great option. We tend to see those who take the extended release version tend to do better in avoiding the significant stomach symptoms. Now, just a word of warning though, don't ask for the 1000 mg extended release metformin because they are super expensive. The 500 mg you can get around for $5 to $10 a month, while the 1000 mg is upwards of $1,000. It's totally insane. I don't get it, so just be warned. The third is to start the dose low and slowly increase it. The most common effective dose for many patients is 1000 mg twice a day. If you need to be up at the higher doses to get your sugars under control, then start at a lower dose like 500 mg. Take that for several days, up to a week or more, before increasing to the next dose. Keep doing that week by week until you get to the full dose. If you start right away at the high dose, you're more likely to spend your day in the bathroom than doing the things that you want to do. So remember, start low, increase it slowly. Now, of course, always talk to your doctor and pharmacist about how they recommend you take it, but ask them about this and see how you do. The fourth step is watch your diet. One of the ways that metformin works is by decreasing how much sugar is absorbed through your intestines. That's a good thing when trying to keep your sugars down, but can make a real mess when it comes to your bowels. One of the things that helps us digest is the bacteria that resides in our intestines. All that extra sugar for the bacteria is like a group of kids in a play gym after Halloween. It's not a pretty sight. The bacteria start to ferment the sugars and create gas and all the other fun things that come with it. So avoiding foods that have sugar or a lot of refined carbohydrates can make a huge difference in being able to tolerate the medication. Now, if that diet sounds familiar, that's how you should be eating as a diabetic anyway. So get to eating right and see how much it helps. Metformin is an important medication that works well to treat diabetes when diet and exercise are not enough. But the fact of the matter is that not everybody's going to tolerate it. These steps will give you the best chance of being able to do well with it, but even then, sometimes it's not going to work. If you find yourself in this position, make sure you talk with your doctor, as metformin may just not be for you. There are other options out there, but you still need to remember that nothing is going to take place of changing your lifestyle. Now, if you're looking for non-medication ways that you should be working on to control your diabetes, then click here. We'll go over this in a bit more detail. I really appreciate you watching today. I hope you found this to be helpful. And if you did, make sure you give this video a like and share it with your friends. It helps our channel to grow and reach others that may need this in their life. And don't leave without subscribing and hitting that notification button so you don't miss out on any of our future content. Well, we appreciate you watching, and we'll see you in the next video.